Hi, my name's Cassidy. I'm a nurse practitioner here today. How may I address you?
Brock's fine.
Brock, okay. And what brings you in today?
I'm just here for a checkup.
A checkup?
Mm-hmm.
Okay. So we'll dive into your health history. We'll do a surgical history, medical history on your family, and just an overview of your health.
Okay.
It'll be roughly around 10 to 15 minutes.
Okay.
Before we get started, I'm going to have you verify your date of birth.
6/24/2000.
How would you describe your overall health?
I'd say it's pretty good.
Okay. Any changes in anything?
No.
Any concerns that you would like to discuss today?
No.
Brock, do you have any allergies?
Just seasonal allergies.
Seasonal? And do you take anything for those?
I do take an allergy pill.
Do you feel like the allergy pills help you?
Yeah.
Okay. No allergies to any foods or medications?
No.
Do you take any vitamins, supplements?
I take vitamin D every day and melatonin occasionally.
And then what other medications do you take daily?
I take 50 milligrams of Zoloft once a day.
And what are you taking the Zoloft for?
Just anxiety.
Anxiety. Do you feel like the Zoloft's helping?
Yeah, definitely.
Are you on any current dietary restrictions?
No.
How would you describe your current diet?
I'd say it's pretty good overall. I mean, I could definitely be eating better, but I don't think it's affecting anything.
Good diet. Have you had any recent illnesses?
No.
Any recent hospitalizations?
Mm-mm.
And then any hospitalizations within the past 10 years that you remember?
No.
Okay, are you okay if we next discuss your medical history?
Yeah.
Any current or past medical diagnoses?
Like we, talked about anxiety, obviously.
Okay.
Other than that, just Raynaud's disease.
Do you take anything for the Raynaud's?
No.
Do you feel like there's anything that helps or worsens your symptoms?
Not really. No.
Next, we're going to discuss your surgical history. Have
Okay.
you had any surgeries in the past?
Yeah, I've had finger surgery. I broke my finger playing football in high school, and they put 2 screws in my finger. And I had my wisdom teeth out as well.
Going back to the finger surgery, do you remember which hand it was and what finger?
It was my left middle finger.
Left middle.
Yeah.
Do you remember what year it was?
2016.
2016. Do you remember the year of your wisdom teeth surgery?
2018.
Any complications with those surgeries?
No.
Do you know if your vaccinations are currently up to date?
Yeah, they are.
Okay. Did you receive your yearly flu shot?
Yes.
Okay. How about a COVID shot?
Yep.
All right. Are you okay if we discuss your family medical history?
Yes.
Okay. Are both of your parents still alive?
Yeah.
And how old is your mother?
She is 55.
Does she have any health history?
Just history of anxiety, history of back surgery. That's pretty much it.
Do you know if she takes any medications for her anxiety?
I'm not sure, honestly.
And how about your father? What is his age?
He is 55 as well.
55. Does he have any health history?
He does have a history of high blood pressure, high cholesterol, knee surgeries, hip surgeries.
Were they replacements?
Yes.
Okay.
I think he had both knees replaced and his left hip replaced.
Left hip and both knees. Okay. Do you have any siblings?
Yes. I have an older brother, older sister.
How old is your brother?
He's 25.
Does he have any health history that you're aware of?
Not that I know of.
No health history. Okay. How about your sister? What's her age?
She's 28.
28. Does she have any health history?
History of anxiety and recent pregnancy.
Any complications with the pregnancy that you're aware of?
No.
No complications. Okay. So next we'll talk about your grandparents' health. We'll start with maternal. How are those grandparents?
My grandma is 78. She has a history of high blood pressure. Nothing else really that I know of. My grandpa is 80 years old. History of diabetes.
Overall pretty healthy.
Yeah.
How about paternal grandparents?
My dad's parents, his father passed away when he was 71, I believe. He did have a history of high blood pressure, high cholesterol, obesity. He did pass away from a heart attack.
A heart attack.
Yes.
How about your grandmother?
She's still alive. She's 83 and no health history as far as I know.
Okay. And Brock, who do you currently live with?
I live with my parents.
Both your parents?
Mm-hmm.
And what's your current education level?
Associate's degree.
What's your associate's in?
I'm a nurse.
Oh, that's awesome. Do you have any religious preferences?
Catholic.
Catholic. Any alcohol use?
Just social.
Social. How often would you say that you're consuming alcohol?
I'd say probably every other weekend. I play in a band, so we're playing like every other weekend or so.
Any smoking?
No.
No nicotine, tobacco, e-cigarettes, vaping?
No.
Any illicit drug use?
No.
And how would you describe your current physical activity?
I can probably be a little bit more active. I was pretty active in high school playing sports, but kind of got lazy when I was in college. But other than that, I think I'm overall pretty active.
How often would you say you exercise?
Probably once or twice a week.
Once a week. Okay, great. So next, Brock, we're just going to do an overview of your health systems, okay?
Okay.
Have you noticed any changes in your fatigue, any blurred vision, chills,
No.
fever?
Mm-mm.
Okay. Moving on to your eyes, do you wear any glasses or contacts?
Yeah, I wear both. I have contacts in now, but
Do you do yearly eye exams?
I try.
Okay. Do you remember when your last eye exam was?
It was actually this week.
Any new blurred vision, floaters, black spots?
No.
Any headaches, photosensitivity?
Mm-mm.
Do you feel like dizzy at all?
No.
Okay. So with your ears and eyes, have you noticed any like nasal drainage, any drainage coming from any of those?
No.
Okay. Any throat pain,
Mm-mm.
lymph nodes that you feel are swollen?
No.
No pain to any of those?
No.
So with your lungs, have you noticed any like chest tightness, any shortness of breath, wheezing,
Mm-mm.
cough?
Nope.
Okay, nothing new. Do you feel like when you exercise, you still don't have any of those symptoms?
Yeah.
Moving on to your heart, any chest pain?
No.
Palpitations?
Mm-mm.
Ever feel like your heart's racing?
Occasionally when I'm working out, but other than that, no.
And it goes back down after?
Yeah.
Okay. Any like recent edema that you notice? Any swelling of any extremities?
No.
How about any abdominal issues? Any bloating, stomach pain,
Mm-mm.
nausea, vomiting?
Nope.
Okay, and how are your bowel movements? Are they pretty regular or
Yeah, I'd say they're pretty regular.
no changes to those?
No.
Have you ever been diagnosed with a hernia?
No.
Next, moving on to urination, do you feel like there's been any changes with that?
No.
No, like urgency, frequency,
Nope.
burning with urination, no blood or discharge noted.
No.
Moving on to your skin, have you noticed any new changes to your skin?
No.
Okay, no new freckles, moles,
Nope.
rashes.
Mm-mm.
Any muscle or bone pain?
No.
Any soreness with those?
Just occasionally when I'm working out, but just muscle pain.
How does your finger fracture feel? Do you ever get pain in that site?
Sometimes, yeah, it depends. If it's cold out, sometimes I get pain in that.
With
but
the weather?
Yeah.
Okay.
I feel like it's pretty normal.
Any new headaches, migraines?
Occasionally I have migraines, but they're not very frequent.
Did you ever take anything for the migraines that seems to help?
No. I usually just take ibuprofen when I feel one of them coming on, and it usually helps.
How
Dram-
often do you get them?
Honestly, once in a blue moon. Dramamine helps sometimes too, but other than that, I don't really get them that much.
Okay. Any history of seizures?
No.
Any numbness, tingling in your arms and legs?
No.
Have anyone ever told you that you've had anemia?
No.
Have you noticed any abnormal bleeding, bruising?
No.
How would you describe your current stress level?
I'd say I'm as stressed as any normal person my age, that has a job. But other than that, I usually handle it pretty well.
And how are you coping with your stress?
I listen to music a lot. Exercise helps too.
Do you feel like you have a good support system at home?
Yeah, definitely.
You mentioned the history of anxiety. Any history of depression?
No.
Any thoughts of harming yourself or others?
No.
And how would you describe your sleep patterns?
I'd sleep pretty good at night.
Okay. Do you find yourself waking up throughout the night?
No, I take melatonin. It helps me.
And then what kind of hobbies do you like?
I'm a musician, so I like to
Musician?
play music a lot.
That's awesome.
I'm into sports. I like watching football, baseball.
All right, Brock, well, do you have any questions, any further comments for me?
No, I don't think so.
Okay, well, it was nice to meet you. Thank you for your time.
Thank you.